There were nearly 15,000 new COVID cases and 158 deaths during a 3-day period in South Carolina this month. This is overwhelming hospital emergency rooms and ICUs. Joining us with a call to get vaccinated is Danielle Schur, hospitalist and Chief Quality Officer for MUSC Health. And we're also joined by Dr. Eleanor Oakman from Roper St. Francis. Ladies, thank you so much for joining us. So it's astounding to learn how many people, it just seems like we've seen this trajectory of COVID cases. And I wanted to ask you, Doctor, if you can tell us why we're seeing such a spike here in South Carolina.
Well, I think the biggest reason that we're seeing a large spike is that we have a large unvaccinated population. So right now in South Carolina, there's only 59% of the people that have even their first vaccine dose. And so there's just a lot of people that are available to be hosts for the virus.
And who typically are the ones being hospitalized? Because it sounded like quite a few were 30 and under. Are we talking more of a vulnerable
Yeah, surprisingly, we have people in all age groups vaccinated, hospitalized right now with COVID. Most of those were with the Delta variant, which is the new one that we've been following this summer. It's much more contagious. I think that one of the reasons that we're seeing so many more hospitalizations in all age groups is also that just people have gotten a little bit more lax about mask wearing. We did a lot of travel this summer, saw a lot of people, which was fun.
People couldn't wait.
But people couldn't wait.
Out.
Yep. And so we spread it to a lot more populations than we did before.
Right. Now, as a hospitalist and working at MUSC, we all received the press release that MUSC was getting inundated. ICU beds were at capacity. So can you talk a little bit about the impact that folks who should get vaccinated, not getting vaccinated, what that impact is on the health system?
Yeah, sure. So, routinely we have several hundred COVID-19 patients throughout the health system on any given day. About half of those end up at some point in their course in one of our ICUs. And oftentimes, with an ICU, the capacity is a moving target, but not only do you have to have a bed, but you have to have trained staff personnel to take care of that patient. And oftentimes we do take care of ICU level patients in other places of the hospital, in particular our emergency department. And so there's a big spillover effect. In addition, we do continue to take transfers from other facilities that are either overwhelmed or don't have ICU capacity. So it really does spill into every area. And
even some other hospitals were eliminating any voluntary surgeries, any elective surgeries, I should say, because they needed to make room for all of these patients. So your campaign, Get the Facts, Get the Vax. So what would you like to tell people who are still on the fence about whether or not they should get the vaccination?
The biggest thing I've heard about people not getting vaccination is just a general vaccine hesitancy about something that's so new. What I would say is we've had over 1 billion people vaccinated already, and the data is excellent that it's very safe and really doesn't cause a lot of complications. People sometimes feel a little sore for a day or have a slight sort of flu-like feeling, but other than that, do quite well.
It passes. Now, you had mentioned the Delta variant. This is much more contagious, that you say. What about the Mu variant? Because now we're hearing of another iteration of COVID-19.
So we don't know a lot about Mu yet. They're going to be named in sequential order. This one's very early on in the population. Hopefully will not become one that becomes very contagious like Delta did. And they're watching it closely to see how contagious it is, how easy it is to spread, and also how sick people get with it.
When you talk about how new it is, though, it seemed like we had experienced COVID-19 and then the Delta just kind of popped up into our news feeds, so it almost seemed like that was also quite spontaneous almost. Did it take time for that to build up? Is that kind of the theory behind it?
It's sort of like the theory, like it just the most potent virus strain will survive the best. And so that's why Delta sort of overtook all the other strains. And now, throughout the Lowcountry and the state, Delta really does represent almost 100% of our cases.
Is that right?
Whether or not Mu will be better than Delta from a virus replication and infectivity perspective remains to be seen, though. But to your point, back to vaccines. Really we're in a race against the variants. So we're either going to allow the variants to continue to proliferate or we're going to all get vaccinated. So those are our two choices, and so really that's why we're here today, is to try to emphasize that.
Are we going to see a situation where it's almost like the flu, where it's a new variation every year and you get the flu shot and maybe it'll protect you, maybe it won't, but it's just going to be kind of a never-ending cycle.
So it's quite possible that we see variants come continuously,
Yeah.
especially in a population that's not fully vaccinated. And what we're finding with COVID is that when you have the vaccine, you can get COVID, but you have a much easier course for it. You're much less contagious to other people. You don't get as sick, so you use less healthcare resources. And so in that, we're finding that it will be a population that is much less able to host a new variant, right? So a new variant that comes into that population will be less likely to spread and sort of develop over time. And so yes, I would guess that it is be something that we might get vaccinated for, I don't know, every year or something like that. We're not sure.
Well, you think about the flu and you think of flu season, but COVID is kind of all year long. So really we're just going to have to change our mindset. So the idea that COVID is going to taper off and then it'll disappear, it'll go away, that's not really
That's very
what we're
unlikely.
looking at. That's very unlikely.
And I think if people can start thinking about it just like we do all other immunizations, that most of us have gotten several dozen immunizations over our lifetime. It's sort of part of going into school. It's part of many of our workplaces, that it really is like, you know, whether it's MMR or Tdap or even, you know, routine screening as we do in healthcare for tuberculosis. I think the more we can get in the mindset of this is just sort of how we're going to operate from here going out, it takes some of the emotion out of it. And again, to our point earlier, this is a really safe set of vaccines. Probably some of the safest that we've ever seen. The side effect profile is extremely tolerable, so we just can't emphasize enough how safe it is, and that we're really just going to have to go ahead and get the vaccine and sort of, you know, weave it into our routine immunization schedules.
You know, and I've heard people who have gotten COVID, got vaccinated, breakthrough cases, but they're less severe. So
without a doubt.
Yeah.
Absolutely.
All right. So get the facts. You got the facts. Now go get the vax, right?
Yes.
I want to thank you
Yes.
ladies so much for joining us.
Thank you so much.
We're back after this.